Hey guys, so when answering the first question, there are many skills that I would use to secure needed resources such as staffing. As a nurse manager, I realized I would have a specific responsibility to the organization and to the staff under me. In my role as a manager, I would use Grohar Murray and Langen's guidance on management responsibilities. These include accomplishing the goals of the organization or nursing division, maintaining the quality of patient care with the financial limitations of the organization, encouraging motivation of the employees and patients in the area, increasing the ability of subordinates and peers to accept change, developing a team spirit and increased morale, and furthering the professional development of the personnel. My goal would be to create a positive work environment that promotes employee satisfaction. I would use planning, organization, and coordinating skills to secure needed resources such as staffing. In Chapter 7, planning is discussed as the primary management function that decides in advance what needs to be done. As a nurse manager, having a plan alleviates confusion and offsets uncertainty. Having a plan allows you to focus on objectives at hand and facilitate control. I would have a plan that ensures an adequately staffed unit to provide positive patient outcomes. This would include having appropriate staff to patient ratios. This would prevent staff stress and burnout. It would also promote patient health and quality of care. As a manager, I would prefer a more horizontal differentiation model. This allows for more efficient and effective performance because there are multiple systems of expertise working towards the outcome of each patient. With regards to staffing, this approach would alleviate additional stress on each individual team so that they can focus on the primary task at hand and provide the best quality of care to each individual patient. Lastly, I would utilize coordinating in my management position to meet the needs of those under my supervision. Good coordinating skills would allow me to again eliminate stressors within the work environment by making sure everything ran smoothly. In relation to staffing, I would make sure each individual had access to the resources needed to effectively do their jobs. I would make sure that everyone was aware of their responsibilities within their position and feel supported on a daily basis. I think these three skills would allow me as a manager to be one, respected amongst my peers, effective in my role, and overall successful within my organization. After completing the leadership questionnaire, I identified most with a conceptual form of leadership. Conceptual skills allows a manager to visualize the entire organization and work with ideas and the relationships between abstract concepts. According to the questionnaire, I'm effective at problem solving. When problems arise, I immediately address them. Seeing the big picture comes easily for me. Making strategic plans for my company is appealing to me. I enjoy discussing organizational values and philosophy. I am flexible about making changes in our organization. Number two, how would you use the published literatures in this process? So the article I found was called Transdisciplinary Healthcare Education, Training Team Players. The authors, whose last names I cannot pronounce, you can see my reference though, focuses on overcoming the health problems of medically undeserved patients. In order to do this, they propose that clinicians must learn the principles of transdisciplinary care from the beginning of their training. In doing so, these providers can learn how to use a support network to provide comprehensive preventive primary care while addressing social and environmental determinants of health that their patients will face. Transdisciplinary healthcare is described in the article as reaching into the space between the disciplines to create positive health outcomes through collaboration. As a manager, this is a system I would want to encourage within my organization. This model of care effectively integrates clinicians such as your physicians, nurses, social workers, physical therapists, PAs, community health workers, and basically any healthcare provider to create a team that promotes comprehensive preventive primary care. Number three, identify the levels and departments that you would need to work with in order to be effective in your role. I would need to collaboratively work with other management teams and those under my supervision to be effective in my role. As a nurse manager on a unit, I would most closely work with the charge nurse on both the day and night shift on my unit. I would also work closely with the patient care coordinator responsible for my unit. Other interdisciplinary personnel I would need to collaborate with would include the nurses on my unit, physicians working with my patients, social workers, physical therapists, and any other healthcare provider that directly was involved in patient care. Number 4, explain if you feel you would have a preference for a vertical or horizontal structure and a particular model and why. I'm honestly torn between the organizational structures. The vertical structure is appealing to me because it has a well-defined chain of command where each team leader has a specific role and responsibility and reports to one manager. As a manager, this would alleviate stress on me and allow me to focus on more important issues at hand. However, if I followed a more horizontal structure, this would allow for an even playing field amongst those under me. It would allow my entire team to have input and be involved in the success of the organization. Thanks, guys. Hope you enjoyed my responses.